Hello doctors, my name is Faraz from Pratima Medical College. Today's topic is Cushing syndrome. Cushing syndrome is due to excess of cortisol coming from drugs, steroids, iatrogenic cause. There are three types of Cushing syndrome: ACTH dependent Cushing syndrome, non-ACTH dependent Cushing syndrome, and ectopic source of ACTH. Let's come to ACTH dependent Cushing syndrome. Seen in 90% of cases, and if there is a pituitary tumor, that means it is a Cushing disease, which is different from Cushing syndrome. Next, non-ACTH dependent Cushing syndrome. It is due to from adrenal glands mostly, where due to adrenal hyperplasia nodular adenoma is seen. Ectopic source of ACTH. It is due to carcinoid tumor from lungs and pancreas. Let's come to clinical features part. It is seen in middle-aged people, and there is a redistribution of body fat is seen. If cortisol excess is present, visceral distribution of fat is seen, where fat is accumulated in visceral area, and there is a ACTH increase, due to which there is a increased pigmentation. Hyperpigmentation is seen, where purplish color is seen near hyperpigmented area. Patients with Cushing syndrome are more prone to osteoporosis due like hip fracture. Severe disorders are seen where hypertension, volume overload is seen. Proximal myopathy is seen where weakness of muscles of hip and thigh is present. Amenorrhea in women is common. Recurrent skin infections are seen. CNS effects are seen. Steroids can cause gluconeogenesis and lipolysis. Next, whenever you remember this topic, Cushing syndrome, this image should come in your brain. Always try to correlate any topic with images like this, so you'll never forget any clinical features in your life. So this is a patient with Cushing syndrome. Buffalo hump is seen behind neck. Thin and arms and legs are seen. Thin skin is seen, due to which there is easy bruising, purplish color discoloration. Stretch marks are seen. Round moon face is seen. Red cheeks. So remember these pictures. Let's come to diagnosis part. Check if there is a cortisol excess. If yes, uh, we search for source. To further do serum ACTH test, where if there is a increased ACTH levels or ACTH dependent, it is due to pituitary or ectopic reason. Further do MRI of pituitary gland. Corticotrophin releasing hormone stimulation test is done. If cortisol is increased, then it is due to pituitary tumor. If it is a ACTH independent and decreased ACTH levels are seen, CT of abdomen is done. Let's come to other tests. 24 hours urine cortisol test is done. Midnight cortisol test from salivary cortisol is taken usually. Overnight dexamethasone suppression test is done, where low dose 1 mg of dexamethasone is taken. High dose dexamethasone test is done to suppress the hypothalamo-pituitary axis. Here 2 mg dexamethasone every 6 hours for 2 days is given. Then on third day look for serum cortisol. If it is not suppressed, that means it is due to ectopic reason. If it is suppressed, it is due to pituitary tumor. Let's come to treatment part. If it is iatrogenic, reduce the dose. If it is due to Cushing's disease, transpenoidal surgery is done, but 70% relapses are seen. Adrenalectomy is done, which is a surgical procedure. Drugs like ketoconazole, methylprednisolone, these drugs block the steroid formation, due to which it is used when patient is severely symptomatic. So gold standard drugs are ketoconazole, methylprednisolone.